Well, hello, everyone, and welcome to Health Forward. I'm Carolyn Colley, and I'm president of the U.S. Chamber of Commerce Foundation. On behalf of our entire team, thank you so much for joining us today. I'd also like to give a big thank you to Genentech and Walgreens Boots Alliance for making this program possible. At the Chamber Foundation, our mission is to educate the public on how business does well, does good, and prepares for the future. Our entire team comes to work every day really knowing and believing that business is an essential problem solver. And that belief has become even more core to our values since March 2020, when we pivoted our work, like everyone else in America and the world, to focus on the emerging pandemic. And since then, we've used this exact tool and asset of ours, which is convening. And we've hosted hundreds of leaders from businesses that are big, medium, small, everywhere in between, community leaders, public health experts, academics, journalists, and community leaders from around the world. And we've had some very intriguing, productive, and questioning conversations on everything from executing a responsible reopening strategy to planning for a post-pandemic world. Over the course of the last 2 years, we've really come to appreciate what health means, and that it's not just something that you think about once a year when it's time for a flu shot or for a checkup. But more than ever, we know that full health is physical health and mental health. And that impacts our lives, of course, and our families, but it has wider effects on our communities and our businesses and on our economy, not just here in America, in the United States, but on a global scale. So today, we're going to lift up and look beyond the now horizon at the future and things that we can expect from healthcare globally. We'll hear from business leaders and experts and innovators on things like the global health landscape, reimagining the future of health. Really importantly, public-private preparedness and partnerships for the next pandemic, and how advancements in technology, which are never slowing down, and telemedicine are helping us reach more people in more places around the world that need access to care. And we'll close with a segment I'm really looking forward to, which is to hear from two young women about youth mental health and why it's so important to invest in mental wellness for the next generation of leaders. So a housekeeping note, please enter your questions into the chat during the program and we'll get as many of them answered as we can. We've got a lot to cover today, a really strong program. Thank you for joining us, and let's get started.
Hello, and thank you, Carolyn, for this setup. I'm Shubham Singhal. I lead McKinsey's healthcare, public, and social sector practices. What I thought I would do is give you in the next 6 or 7 minutes a sense of the big trends around healthcare at this moment that leaders around the world are watching and working against. And then we'll open it up to some Q&A. So the 7 trends that you should kind of have on your mind that leaders are watching. The first is a talent shortage. This has happened across many parts of the economies, including in healthcare. And as the attrition of nursing staff, physicians, the early retirements, et cetera, have increased, we have seen a shortage appear across the world. And it's interesting, as many times when the shortage existed in developed markets, you would see a movement of talent happening from developing countries, but we're actually seeing the shortage extend to many of the developing countries as well. So how do we actually attract and rebuild the clinical and the labor in healthcare services is a big challenge leaders are tackling. The second is inflation. I think everyone knows that is on the move. And in healthcare, inflation many times moves a bit slower, but can be quite significant and quite sticky over time. As the costs go up, they don't come back down quite as easily as the rate of cost increase goes up. To give you a sense, just if you look out 5 years from now, inflation would result in, just in the United States, costs being $370 billion more than they would have been as we looked before the pandemic and before inflation reared its head. The third, and as a result, is sustainability of healthcare costs. Dealing with the pandemic has required all hands on deck, all resources put in against it. A lot has been spent into the healthcare system. And as we look at further investments to be made, and we look at the pressures of inflation, the sustainability of healthcare costs has become an ever-present challenge that many are now beginning to grapple with. The fourth is around COVID. While the pandemic maybe has ended in many parts of the world, COVID is here still and is going to stay with us. And endemic COVID, in addition to continuing to threaten lives, is also puts strain on the healthcare system, as well as a financial burden. Again, analysis that we've done in the United States suggests that the ongoing COVID costs add another $220 billion of spending required just in the United States every year for treating COVID and all the spend that goes around that. Then if you look at a couple of the trends that had been playing out before and are ones that leaders are really focused on, aging, particularly in developed societies and even some of the middle income countries, is a real issue. We have an aging population. It takes down the workforce. It increases the need for healthcare services. It increases the need for the care and people required to provide those services. And, you know, people are living in old age for longer at this point, more so than any time in history. So how do we get people to be in good health, in productive health, in ability to do the kinds of things that they want to do, and perhaps even continue to work should they so choose to? That is kind of the challenge of the day. What we have generally gotten quite good at is extending health. We have not yet gotten good at figuring out how to keep people in good health in that extended period of time that we have seen life extension happen. And that is just an area that so many around the world are trying to now figure out and see how we provide those kind of the healthy aging of societies. Number 6 is around chronic conditions. Again, this is something even pre-COVID has been one of the biggest defining moments in the last 20 to 30 years. Interestingly, some of the countries who did not see the kind of chronic conditions as some of the Western nations had, for example, in Asia, are beginning to see the rise of things like diabetes, which then leads to a number of other conditions. One of the things that COVID has made us aware, and Carolyn talked about a session that'll happen later, is the recognition of mental and behavioral health, which has risen quite significantly, and our understanding of it during this time. But how do we provide the access and the treatment with behavioral health as another chronic condition, and one that actually exacerbates a range of other physical health conditions over time? And how do we pivot our healthcare systems, which are quite meaningfully designed around hospitals so we can treat people when they have acute events? How do we turn that around into being able to provide care to people on a continual basis, but also enable people to be able to care for themselves and their chronic conditions? And the final one, perhaps, is the positive end of this, which holds promise, yet to be fully delivered, but we saw how telehealth was able to bring access to many during the pandemic lockdowns. More broadly, could the power of data and technology enable us to have a more productive, more present, more accessible, better experience, better quality outcome, and ultimately more affordable healthcare system. There are signs and small innovations that seem to suggest that might be on the horizon, but a lot needs to happen, particularly to scale up these innovations that we see in small areas. So those are the seven I would leave you with as a bit of provocation to the discussion in the rest of our time together. But let me invite Hillary Crow to moderate some of the questions you might have.
Thanks, Shabam. That was a helpful overview of the future of health landscape. So in the few minutes, really couple minutes we have left, wanted to share a few questions that we've received from the audience so far. First one is, what are some of the most promising medical developments that will help people in the near future?
I think there are many, but we're going to point to a couple. We saw the mRNA vaccines really kind of come to the fore. That was not a technology that we had used, and those have been quite effective against the COVID virus. They also are showing that they can be quickly rejiggered for new variants. I think that is going to be a great platform for further innovation, whether in vaccines or frankly, where it was being targeted for cancer treatments and the like. So that's one to watch. The broader area of gene therapy and genomics is another one where there are a number of treatments arriving that hold great promise.
Okay, and time for just one more. This has been a big topic of discussion over the course of the pandemic in creating greater access to care for those all around the globe. And so this question asks, what's the biggest impact technology can make in providing healthcare to underserved populations?
It's a very good question because equity of access is one of the biggest issues to resolve. Now, I mentioned earlier, telehealth has been an area that's expanded access, particularly in behavioral health. It doesn't solve all, though, because not everyone has access to broadband or high-speed internet. Mobile technologies, though, have been deployed in many countries, including lower-income ones, where you can actually gain access to professionals in very meaningful ways. So those are probably going to be, as we look at the combination of devices, the combination of mobile communication, and over time, as we expand access to internet, of telemedicine itself, the expansion of access into rural areas, into disadvantaged communities and far-flung ones is one that holds great promise over time.
Great. We are out of time, but thank you, Shabam, for joining us and looking forward to our next segment with Suzanne Clark and Anita Alaman from Walgreens.
Thank you, Hillary.
Well, hello, everyone. My name is Suzanne Clark. I am the President and CEO of the U.S. Chamber of Commerce. I am joined today by Anita Alamand, who is the Chief Transformation and Integration Officer at Walgreens Boots Alliance. Anita, thank you so much for being here to talk about your role and your company and how you're reimagining healthcare.
Thanks for having me. Good afternoon.
We're thrilled that you're here. I think what you're doing is so interesting. So, new CEO, Roz Brewer, she becomes the new CEO in March of 21, and she, within 6 months, creates this new role, puts you in it, and we're talking about a retail leader, a pharmacy leader, who has great executive leadership, has a new strategic vision, is going through a major transformation, but you're doing this all while we're still in the middle of a global pandemic. So there certainly is a lot to discuss. Maybe we start with the title. So what is a Chief Transformation and Integration Officer?
Yeah, no, and thanks for the question. As you mentioned, when Roz Brewer came into role last October was a very pivotal point for us at Walgreens Boots Alliance. We introduced our 4 new strategic priorities. One was transform and aligning our core business. Second, and more importantly, where I'm spending most of my time around transformation and integration, is our new growth engine of Walgreens Health. This is really our expansion beyond pharmacy into other healthcare service. So really in my role, and you can imagine these key priorities of transforming our core business, building a new growth engine, all the while building a high performance team, and then allocating our capital in a very efficient way. There's a lot to coordinate across the organization. And my role really is to work closely with Roz and the divisional leaders to do 2 things. One, establish and coordinate our overall transformation agenda as we prioritize healthcare. And second is to operationalize and integrate the investments and the partnerships we have. I'll share with you some of the examples that we're working on with Village Medical, CareCentrix, and Shield. So these are all that we are investing in. And the goal really is to be able to integrate them very effectively to the organization. So doing 2 things. One is continue to look at where we need to invest in healthcare. And then second is making sure we're coordinating across the organization and across our partners to really derive value.
Okay, so you're reinventing Walgreens. This seems easy. That must not take much of your time at all. But tell us, I want to ask you 2 questions. One, because it actually seems quite hard, what is the big picture goal? If you could explain to our audience in a couple of sentences what you're really trying to achieve.
Yeah, in the most simplistic sense, the big picture is to leverage both our healthcare providers, our pharmacists, our clinicians, so both healthcare providers and investments in technology to become the neighborhood healthcare destination. And that's really important because we think healthcare is very local. Each neighborhood is different, right? So to be able to ensure that we become that neighborhood destination. And the result of it is very simple. We'll improve access to care, we'll improve quality and experience, and ultimately drive down costs in the overall healthcare ecosystem. So again, it's to be the neighborhood healthcare destination. You know us as the neighborhood pharmacy and retail destination. We just want to be able to expand that and create additional healthcare services using both the clinicians and the technology.
So you administered some close to 70 million vaccines, 27 million tests. What did treating your customers in the pandemic and in kind of this new way, what did that mean? How did it contribute to the way you were thinking about yourself as a company and who you might be in a neighborhood?
Yeah, that the pandemic really, I would say, brought to light and made us all recognize and realize how important retail pharmacies are in fulfilling that last mile of healthcare. We are fortunate that we have over 30,000 trusted pharmacists who've built strong engagement and trust in the communities we serve. As you mentioned, the numbers around vaccination, testing, we realize that really, as I mentioned earlier, care is so local, and especially during the pandemic, almost half of the Walgreens stores are located in socially vulnerable areas, and that means 78% of the population lives within 5 miles of a Walgreens. So we had the ability and the responsibility, frankly, to stand up and address some of the persistent disparities in care and make sure that we were available and bringing our services into the community. What it helped us realize is the value that pharmacies provided in making care so accessible, ensuring medications, scaling testing, scaling vaccinations. So as a company, we also, during this time, we accelerated every aspect of our digital agenda that was already taking place. We looked at how could we advance some of the most important investments we're making, both with the goal of ensuring we can deliver more healthcare services within these settings where the community needs us the most, and at the same time, making sure that our pharmacists and our technicians actually had the time to deliver these services. So we were leveraging technology and advancing our technology agenda so we could, in fact, ensure that they had the time by automating certain aspects of the job to be able to spend time in the communities, making sure that we were taking care of the neighborhoods. So as you said, the 67 million plus vaccination to date, we also relied, quite frankly, on a lot of local partnerships to go that extra mile. So in the beginning of the pandemic, our equity work was supported by key partner organizations who helped us expand our reach into the communities. So some examples, we partnered with Uber to secure free rides to and from vaccination sites with up to 10 million free or discounted rides to reach our patients wherever they are, especially those who live in historically disadvantaged communities. We brought our COVID-19 vaccinations to community members through offsite clinics. And then we hosted several events to help spread the message in various diverse and community-based partners. So I think through the pandemic, two things. We realized the trusted role that pharmacists, pharmacy technicians, and pharmacies played. We realized that our pharmacists could and should be doing more to practice at the top of their license. And third is we ensure that all the digital investments, enhancements we were making would actually allow them to both go into the community and have time to deliver these services. So I would say it fundamentally shifted and accelerated a lot of the strategies and the investments we already had in place.
So what does that tell you moving forward as part of your strategic plan? What are the other critical components, either in terms of people? We hear a lot at the U.S. Chamber about a worker shortage. So is that a critical component? What other kinds of critical infrastructure and people needs do you have?
Yeah, so absolutely. So as we think about infrastructure, I would say it's threefold. We continue to think about technology as a foundation of supporting and streamlining the pharmacy care model. So I'll give you an example. Walgreens is one of the first pharmacies to leverage micro-fulfillment centers to drive efficiencies and cost savings in that last mile delivery of prescriptions. So by removing some of the work from pharmacies, pharmacists get additional time to focus on providing patient care and clinical services. So it helps us in that labor shortages. So these centers remove routine tasks and excess inventory from the pharmacies. We also use cutting edge automation technology in our existing distribution network to fill almost 50,000 prescriptions daily. So the prescriptions are filled offsite, but they come back into the stores for patients to pick those up. So we've opened 2 micro-fulfillment centers, and we plan to open an additional 9. So think about technology as a core, as I mentioned again, of automating and removing work. The other, I would say, infrastructure that we are focused on through pharmacy is expanding our services. We can fill gaps in care in communities where physicians are not easily accessible, and we can help to ensure that everyone has access to essential medications and health services. In fact, 9 in 10 Americans, as I mentioned, live within 5 miles of a pharmacy, and pharmacists are oftentimes, patients see their pharmacists and their pharmacies more than they do their actual physicians. So we're investing in additional services. We've proven the value of the pharmacists, so we're expanding the role of the pharmacist to in certain states where we can test and treat patients. So examples of that could be flu, strep throat, RSV, etc. So I know as a busy mother of kids, the ability for me to be able to take my children, have them quickly tested for strep, and then have the pharmacist in fact be able to prescribe and treat those symptoms with an antibiotic or an antiviral if needed. I think again, that's another example of reducing time to treatment and reducing some of the administrative burden we have in the healthcare system too. So I would say continued emphasis on technology, continued emphasis on additional services that pharmacists can do, all that wrapped around ensuring that we have a digital infrastructure so our customers and patients can really leverage us in an omni-channel way, digital technology to fill their prescriptions, get their questions answered, find care, treat care. So really it's around meeting patients and consumers where they are.
It's interesting. I was lucky enough to spend some time with Roz a few weeks ago, and this concept of how many street corners, how many counties you're in the United States is a big piece of this, isn't it? I mean, you have the footprint to expand access.
Absolutely. Absolutely. And really importantly, where we are, especially, another example I'll give you, our partnership, as we think about what else are we doing in healthcare. And I'll walk through some of the partnerships, but that footprint and customer base is really important for us to scale new healthcare models. So I'll talk about Village MD. Through our relationship with Village MD, Walgreens is the first national pharmacy chain to offer full service primary care practice sites alongside pharmacy services. So this is not just about, transactional acute illnesses. This is Village Medical at Walgreens provides full service primary care, medications, immunizations, lab testing. Imagine, if you will, 4 to 5 exam rooms, lab, all of that, just like you would if you go into a primary care physician's office, in a very simple one-stop care model. And half of these clinics are located in medically underserved and rural areas. So think about really expanding access, especially in medically underserved and rural areas. So the footprint really becomes very helpful as we think about scaling additional healthcare models like the primary care model. The second example I'll give you is what we're calling health corners. We have 60 plus Walgreens health corners with a goal of 100 plus by the end of this year, where we're working with 3 payer partners. These are health plans: Buckeye Health Plan in Ohio, Clover in New Jersey, and Blue Shield of California, to deploy health services to their members. And they become really, these health corners become an extension of the health plans that are located in select Walgreens stores with a dedicated space where a registered nurse or a pharmacist can provide healthcare services. And they range anywhere from preventative care and wellness checks to managing chronic conditions. So think, as an example, of scheduling a mammogram, scheduling a patient for a high blood pressure or diabetes, helping them find digital medical devices. So really, again, going back to your question about managing that footprint for additional healthcare services, because oftentimes, as I mentioned, there is a big gap between when a patient goes in to see their physician to the next visit. So in some cases, if you're just going in for an annual screening, you see your physician once a year. All those other months between, our footprint and our services can help patients be really healthy by doing some of these routine preventative measures.
So I'm trying to envision across the breadth of your stores, how do they look different in 1 year? How do they look different in 5 years? So how will it feel different for me to go to my Walgreens in Arlington, Virginia, and how will it look different, feel different in the coming years?
Yeah, no, again, good question. So, as I said, one of the key tenets of what we are doing is building partnerships in local areas. So the 2 others that I did not yet mention, we have a, investment ownership in a company called CareCentrix. It's a post-acute, and home care is one of the most important aspects of that patient journey. So they're focused on creating a world really where individuals can, they come out of the hospital, they can either go into a skilled nursing facility or, in fact, heal and age at home to provide an expansion of our capabilities. And I say this because I'm going to use a very specific example of, what our stores will look like. So hospital readmissions is, at this point, one of the costliest episodes to treat. The statistics show that almost 30% in some cases of patients are discharged from the hospital, and within 30 days, they're back in the hospital. Lots of reasons for it, some of which, a big percentage don't have primary care physicians. Some of them go into the hospital with a set of medications. While they're in the hospital, they're prescribed a different set and they come out with a different, and it's confusing for those of us who even live in this world of healthcare to understand, what am I taking? Should I take the ones I took before? So those are some examples. And so now imagine a world where we're actually able to connect all of this. As someone coming out of the hospital, through our partnership with CareCentrix, as someone at the time of discharge, helping them understand, do you have a primary care physician? No, let me, if it makes sense for you, connect you to a primary care physician within Village MD, which is in a Walgreens store. As they are leaving the hospital, they might say, I don't want to go in a skilled facility, but I want to go home. We can take care of all their home care needs, whether it's durable medical equipment, whether it's medications. Our Walgreens pharmacist can help them manage their medications, help them do what's called a medication reconciliation. So now they know exactly what they need to be on, and then continue if they want to between their visits to their physicians, come in, get their blood glucose checked, get their blood pressure checked. So you can imagine a world where Walgreens now becomes our footprint, our stores start looking very different. It becomes really a healthcare destination where more and more healthcare services and care can be delivered. And with the rising healthcare costs and more burden being placed on patients to cover these costs, patients are going to, and customers are going to demand more care be delivered on their terms, whether it's about having access, whether it's having a coordinated experience. And so you'll start to see our stores really all about the retail space will increasingly become that destination. And it's about making, whether it's all the way, so think about wellness and prevention. So what products we're offering in our stores with wellness in mind. Then we've got our pharmacies. Now you've heard me talk about screenings, devices. You have a personal advisor helping you decide, I have diabetes. What digital device should I use? There's so many digital devices. How do I actually use it? How can that data be stored somewhere where my physician, my pharmacist have access to it? And then based on that data, can the pharmacist reach out and say, hey, I can tell that you're not taking this medication. What can I do to help you? Is it about financial literacy? Is it about understanding? And then really think about across that continuum. Now that same person is in the hospital. We can care for them in the hospital when they're discharged all the way through end of life. So our goal is end-to-end services that are unique and personalized to each individual customer or patient, and the ability to deliver it in local neighborhoods. Now, we also know, that works for my 81-year-old mother who goes into Walgreens every week and wants to talk to her pharmacist. It doesn't necessarily work for me as a busy professional and a mother of, 2 teenage girls. And so for me, it's all about digital technology. Tell me what I need to know, show me easy access, deliver these medications to my home, help me make the right choices. So we're really thinking about how do we personalize all of this, leveraging both technology and our footprint to be able to do it. So a year from now, you'll start seeing all these services that I said. So you'll see primary care physicians in pharmacies. You'll start to see us coordinate more care across the ecosystem. 3 to 5 years, our footprint in our retail space will look very, very different. You'll walk in and you'll say, I am in a healthcare model, a care delivery model.
It's a big vision. Let me ask you, in the minute we have remaining, Anita, what makes you optimistic about the future of healthcare in America?
I would say 2 things really. One is if you look back and you think of the success we had in the pandemic, it was really a validation that this model works. We've got the trust, we've got the engagement, we have the footprint and access. So that gets me really excited, knowing that we were able to do that, and then now we're building upon it. The second thing that makes me really optimistic is across the spectrum. If you talk to anybody, patients, and we do a lot of testing, they're ready for a different experience. Healthcare is fragmented, it's expensive, it's confusing, and it's been a different model. And at WBA and Walgreens, we want to put the patients and the customers right in the middle, and say, what is it that you need? How can we make it personalized for you? How can we make sure that we understand all your needs? And then we can think about how we coordinate. So to me, healthcare is becoming like other industries where the patients are driving the decisions. And we know that we have the ability to help them do that. So those are the 2 things to me, get me really excited about our strategy, because I know we can do it.
Anita, thank you so much for being with us, for sharing a big vision, a big plan, and an optimistic look at the future. We appreciate your work and look forward to checking back in with you along the journey.
Absolutely. Thanks for having me.
Hello, and thank you for joining us. I am honored to welcome Dr. Maria Van Kerkhove from the World Health Organization. She has agreed to share an update on COVID, something that is still top of mind for millions of people around the world. Thanks for joining us, Maria.
Thanks so much for having me.
So I want to start out with kind of a level setting question. We heard earlier in the program that the pandemic has ended in many parts of the world. Do you agree with that? And I assume not. What is the state of the pandemic?
Unfortunately, the pandemic is not over. We're certainly in a different stage of this pandemic. We're in a much better position than we were in the beginning, even a year ago. But we still have millions of cases being reported each week. And that's on the backdrop of surveillance and testing dropping massively around the world. So we actually believe that there are many more cases that are out there of either new infections or reinfections. So millions each week reported to us. Deaths are around 8,000 to 15,000 deaths per week from COVID-19. So we're still very much in the thick of it. Now, many countries have ended this emergency phase of this in their countries because they've had access to these life-saving tools like diagnostics and therapeutics and vaccines, but it's not the same around the world. We still have 32% of the world's population that has yet to receive a single dose of vaccine. And with waning immunity over time, given that we're in the third year of this, we expect there to be further waves of infection. But because we have tools, those further waves of infection don't need to translate into further waves of death. So we're in a much better place than we were in the beginning, but there's a lot more work to do. And that's what we're here to do, end this emergency in every country on the planet.
So I know you don't have a crystal ball, but picking up on what you just said about future waves, are there, among the new variants that we're seeing pop up in the sequencing, are there any new concerns about a wave in the not too distant future?
There will be further waves in the future. I think what we need to be is prepared for that. Omicron, which is the dominant variant of concern around the world, is in every country right now. There are more than 200 subvariants of Omicron that we're tracking at the moment. Some of them are more concerning than others, but they all have properties of increased transmissibility. Some of them have immune escape, which means our immunity is not as strong, either from past infection or from vaccination. So they don't work as well. They still work incredibly well at preventing severe disease and death, but we don't know if these further variants that will emerge will have more or less severe severity. And that uncertainty means we have to be ready. We have to be ready to scale up and scale down our response. Look, we understand that COVID-19 is not the only problem or even the dominant problem in some countries, health or non-health. We have other health emergencies, we have war, we have climate change with flooding and hurricanes, we have drought, we have displaced people. There's a lot of challenges that countries are facing, economic crisis, energy crises. And COVID is one of the problems, one of the challenges that we have to deal with at a global level, but COVID-19 has solutions. We can reduce the spread while keeping our businesses open. We can reduce the spread while living our lives a little bit more safely than we did previously to this pandemic. And we have vaccines. We've had more than 12.7 billion vaccine doses administered to date, and yet we have billions of people that have not yet been vaccinated. So, vaccine equity is not a hashtag. This is a real challenge that we as WHO are trying to address with our partners. And even in high-income countries, low-income countries, if you look at who is vaccinated, this is our biggest concern. The people who are most at risk for severe disease, over 60, people with underlying conditions, immunosuppressed populations, and critically our frontline health workers, a large proportion in almost every country are missing the full dosage of vaccines that are required, which means they're vulnerable, which means those individuals can end up in hospital. And our hospitals, frankly, around the world are just overburdened. So there's just more to do, but I'm hopeful in my crystal ball looking forward that we can tackle this. We just need the agility, the patience, the vigilance, and to handle it. And that's hard right now because people are tired of talking about this. I'm tired of talking about it too. But we have a responsibility to do what we can to keep people alive now.
So we solicited questions from the audience before this program, and one theme that really came through was in a really simple question from someone who stayed anonymous, who asked, is COVID ever going to end? Is it?
The pandemic, the emergency of COVID will end. Yes, I can say that hand on heart. What I can't say is when. So we will live with this virus. This virus is not going anywhere. SARS-CoV-2 will be a virus that will circulate, but COVID-19 is a disease that we should be able to manage. People don't need to die from COVID-19, from infection from this virus. And we can do that because we have diagnostics that can get patients into that clinical care pathway early, get the antivirals that they need early in their disease course. We have therapeutics that deal with severe disease. And we have vaccines that prevent all that from happening in the first place. So there's a lot that we need to be able to do. We need to live with COVID-19 responsibly. We're not there yet. To allow the virus to spread uncontrolled is not a good situation because of the uncertainty about the virus and its ability to mutate and to change. So we have to handle both sides of this equation: reduce morbidity and mortality, severe disease, reduce severe disease and death. We can do that with the tools we have. Reduce the spread while living our lives safely. We can do that with some distancing, with wearing of masks indoors, with improving ventilation. There's a lot that we can do here, keeping our hands clean, which are good for not just COVID, but for other diseases that are circulating. It will end, and I know a lot of people out there are really suffering, not just from the disease itself, but from the impact of this virus. People have suffered, families have suffered, communities, businesses. We have to find a way to manage this responsibly. We can do this. I feel like a cheerleader sometimes, but I'm going to keep doing this. I'm going to keep at it and keep saying this because, of all of the global problems that we have that don't have solutions right now, COVID has solutions. We just have to use them, and we have to be agile. And again, it's tough right now, 3 years in, but there's a lot that everyone can do, and everyone still has a role to play in this.
So I want to zoom out a little, and it's been a really intense few years for you and for Dr. Ryan and for others at the World Health Organization and for the millions of nurses and doctors and allied health professionals who have borne the brunt of this illness. When you look back, is there anything that you've learned over the course of the global COVID response that changes the way you think about public health, either in a positive way, a negative way? Like, what have you learned from this experience?
Oh my goodness. I mean, how much longer of the program do you have? It's everything. I learn something every day. I mean, the humility by which we need to tackle these big challenges is something I think that stays with us. There is always something to learn, and I think I learn something every day. It's how you apply that. What do you do with that information, and how do you apply that going forward? I mean, the world was unprepared, and we remain unprepared, unfortunately. We're in a better position because the world has gone through a trauma, and we've changed some systems. We just need to sustain that going forward. I mean, personally, I am so fortunate to work at the World Health Organization. I am privileged to work here. I feel privileged, and I'm in a very privileged position to be able to lead our health operations and technical aspects of the response. The forward-facing aspect is an additional thing that I do, which again is a privilege, but it comes with a massive responsibility. Communicating uncertainty in an evolving event where the data is changing, your understanding is changing, is exceedingly difficult. It still is, because people just want to know the answer. I've had so many people say to me, like, okay, when will the science just end? Can you just give me an answer so then we can move on to the next question? But that's not how this works. You're learning, and you're constantly, in the position that I'm in, I work with technical partners all over the world, hundreds of thousands of people in every country, and we gather information, every shred of information we can. We distill it, we debate it, and then we turn that knowledge into know-how, and then that know-how into how-to. And we work with our partners, we work with communities, we work with health professionals, we work with businesses to turn guidance into policy, and that's not the same thing. But I learn something every day. I'm grateful for the resilience of people. I'm grateful for the honesty and the interest that people have in wanting to absorb information and to pull for good information. I'm concerned that we are not addressing the inequalities that existed before this pandemic that still exist now and were exacerbated during this pandemic. That is something that we have to learn and build from. And I'm concerned that the sense of complacency is not building a stronger foundation for the future. So for me, responding to COVID is about pandemic preparedness going forward, because everything we do now is laying a stronger foundation. So in the role that you play, in the role that the audience plays, what are you doing to be better prepared to deal with the current crisis? And maybe the crisis is over exactly where you are, but what are you doing in the situation you are to be better prepared the next time? Because unfortunately there will be, but it doesn't have to be like this. And we can mitigate these impacts. But I don't know, I'm learning all the time. But communicating uncertainty, acting with humility is something I think all of us need to learn and need to relearn. So, yeah.
Well, no, that's really helpful. And, as someone who has consumed a lot of information that you and others have shared from the podium at WHO, I have to say that one of the things that really stands out is your willingness to say, I don't know, which might be the hardest words in the English language. So, that brings me to another area I'd like to explore, which is, COVID arrived at a time of declining trust in institutions around the world. As one of the people who's been responsible for communicating about COVID and thinking about the next pandemic or the risk of the next pandemic, what role does trust play in these communications? And, is there a link between societal trust and public health?
Oh, absolutely. I mean, trust is everything. Outbreaks begin and end in communities. And if you don't have trust before the event, it's very difficult to build that during. And this pandemic has challenged all of us. I think, communicating what you don't know is not enough. I have no problem saying I don't know, but I want to be in a position to say we don't know because the answer isn't there yet. Not because I don't know because I haven't done my homework or I haven't reached out to the right groups. But in my own and our communication around this, it's we say what we know, we say what we don't know, and we say what we're doing to find out. Because it's not enough to say, I don't have the answer yet. I want people to hear from us as the World Health Organization that we have reached out to people around the world to answer that question. And then when we answer it, we ask it again because we have the next variant or some kind of change. But communicating that to people, it's all about trust. Trust is very hard won and easily lost. So I think for us, it's important that we're out there regularly. And if we get something wrong, which we have, because we're human and it's difficult, you come back right away and say, let me clarify, let me correct that. That doesn't make the news. What makes the news is, if you slip up. But,
right.
I'm human. We're all human and we've made mistakes. Everyone has made mistakes, but you got to keep coming back. And I think the openness, the honesty in it, is really, really critical. But there's a lot that's chipping away at trust, and that is something that we just constantly need to be working at. Trust is at an all-time low at a global level, and that we need to work really hard at rebuilding trust over the next many, many years.
So speaking of humanity, and here's another audience question. We only have about a minute and a half, and I have one more other question. But first, so burnout is a huge problem for frontline health workers around the world. And what the audience member wants to know is, as someone who has been at the forefront of the global pandemic response, how have you managed to keep it together and avoid burnout? Are there lessons you can share with other public health messengers? Well,
look, it's been an incredibly challenging couple of years for me personally, for all of us. And I'm not going to sugarcoat that. So I'm struggling just as many people out there are. I feel a real sense of responsibility and drive because I know what we need to do. I work with amazing people at WHO and with our partners. I have a family that is incredible. I have friends that have been supportive in this, but this has been difficult. So I don't think we should shy away from that and talking about the challenges that we are facing and how we're working through this. Because I think all of us need to deal with the mental health aspects of this and the challenges going forward, but we have a goal. And the goal is to end this everywhere. And that's what gets me out of bed every day. And that's what gets me to work with many amazing people around the world.
So let's end on a really positive note. You mentioned family. I have a child. Lots of our audience have children. The hardest questions are coming from kids, and they want to know, How can you reassure me that everything's going to be okay? What would you say to those children?
That's it's a very, very difficult question, but I think we have to work together. I mean, children offer incredible insights into the future of how they're going to deal with things. I take a lot of inspiration from children and from the youth around the world. They are inheriting problems that we are leaving them, but we can do better, and we can all do better. It's an opportunity to bring them to the forefront and bring them into the solution, because they're incredibly brave and have incredibly great ideas that all of us need to utilize and think going forward. But we have to work together. And we reassure our children as best we can every day. We hug them, we hold them tight as fiercely as we can, but we have to fight for kids everywhere in the world. It's not just about our own children, it's about them everywhere. So we have to fight this inequity that exists around the world so that all kids can remain safe.
Well, that is a wonderful way for us to end this all too short conversation. Dr. Maria Van Kerkhove, thank you very much for your work and for taking the time to speak with us today. Please know that we stand ready to help the World Health Organization and others around the world in any way we can. But thank you again for coming and joining us today.
Thank you so much for having me.
As a program of the Task Force for Global Health, TEFANET is a global network of field epidemiology training programs created to train and mobilize the public health workforce across the world to fight the outbreak of diseases like COVID-19. This network consists of more than 70 programs working across more than 100 countries. These programs are designed to train public health workers, doctors, nurses, veterinarians, and other professionals in field epidemiology and other skills to detect and respond to infectious disease outbreaks and other public health emergencies. Every program takes a learning by doing approach, where the majority of the training takes place in the field and enrollees get direct experience providing essential health services to their countries. In an event like COVID-19, FETPs engage in a series of actions before, during, and after an outbreak based on operational guidelines from the World Health Organization.
I'm Nisha Biswal, Senior Vice President for International Strategy and Global Initiatives here at the U.S. Chamber of Commerce. And I'm joined today by three of the leading experts that have really helped us navigate the global COVID pandemic to talk about some of the lessons learned and how we prepare for the next pandemic or health emergency. Jill Schatzberg, who is the Senior Director for Federal Government Affairs at Genentech, Dr. Caitlin Jetelina, renowned scientific communicator and founder of Your Local Epidemiologist, and Lissandro Torre, the Emergency Response Lead at TEFANET. Thank you all for joining us. And before we talk about the future of pandemics, Caitlin, can you tell us where things stand with the current pandemic?
Yeah, so, epidemiologically, we're in this transition phase right now, and we are going into winter. We know that coronaviruses thrive during winter season, and so we're all kind of holding our breath to see what this winter brings with us. A lot of eyes right now are specifically on Western Europe, where hospitalizations for COVID-19 are increasing pretty quickly. And pretty worrisome is that it's not being driven by a specific subvariant, but rather by weather, by behaviors, etc. There are subvariants on the horizon, though, that we're keeping very close track of that are increasing and that will probably add fuel to the fire. So I think that this winter will be very telling of where exactly we are in this emergency phase of a pandemic. I think it's really also important to recognize where we are kind of socially too. The definition of a pandemic isn't determined by us epidemiologists. It's a global consideration where we think morally, psychologically, And epidemiologically, we all define what an emergency is. And I think each country right now is trying to determine where they are in that spectrum. In the United States, we are in a very weird transition where our hospitals aren't overwhelmed, but we're not in this predictable state. And so this is very confusing to a lot of people. A lot of messages are getting lost to people. And again, it's unfortunately impacting our vaccination rates. So it'll be interesting to see what happens this winter. And we're all kind of at the edge of our seats.
You're so right that this is a pandemic that really has affected us, not just from the standpoint of the epidemiology of COVID-19, the virus, but actually as a societal response to that virus, to that pandemic. And so maybe, Jill, I can turn to you next. We have experienced this as a society. And so, what are some of the key learnings from your perspective that we should be bringing into our preparedness for the next pandemic?
Absolutely. Thank you. I think one of the key things that we've learned throughout this process is that there's no one group or entity or division that's going to be able to tackle this alone. This really requires different organizations in the private sector, the government, academia, all to come together in order to really combat these type of threats. And I think the other thing we need to think about is early preparation. We need to be preparing now for the next pandemic, not just to combat what we're currently dealing with in COVID. And that means building out the appropriate infrastructure, streamlining decision makings, and not losing the lessons that we're living right now. And I think there's a couple ways that we can do that. It involves building out manufacturing capacity, continuing to invest in innovative medicines. We've got two key examples here. One, our mRNA vaccines. Those were in development for years. But had we not continued to make investments in that technology, we wouldn't have a readily available treatment for a new threat. Additionally, I think about influenza as much as I think about COVID. We know we have the tools available right now to mitigate and optimize delivery through vaccines to prevent, diagnostics to identify, and therapeutics to treat. You may have heard of the test to treat pilots that are currently being run in COVID. Those can be expanded to incorporate influenza as well, where you can have a site of care differential diagnosis between these two threats and treat them on site. And then we can learn how these communicable diseases can be curbed as well as severity of disease. So we need to tap into what we have now and plan ahead. The last thing I want to mention in terms of a key lesson learned, we have to take bold action now to dismantle health inequities. We saw from COVID, and we've known from past influenza surges, that globally and in the US, there are certain populations that are disproportionately impacted by these pandemic threats. And so we need to continue to work and strive and collaborate together in order to reduce access barriers so that everyone can access innovative medicines wherever they may be. So those are some of the key broad societal lessons that we need to carry with us as we start planning for the future.
Jill, thank you. I think you raised a number of really important points. And Lysandra, why don't I bring you into this conversation, both to build on some of the points that Jill just made, but also maybe if you could start us off with, the first part of response is really detection, disease surveillance. And clearly, we did not have in place adequate mechanisms for surveillance with COVID. But now with monkeypox, again, I think are seeing that we did not have all of the tools that are necessary to really understand, the early detection and the spread of this virus. So can you tell us what's being done on that front, and then also on a couple of the points that Jill made about additional investments for preparedness?
Yeah, thank you so much, Nisha, for that question. I think so. My perspective is more of a global perspective. So I would say, in terms of surveillance and in terms of solutions for detecting monkeypox outside of the United States or coronavirus before, it is that increased connection from the local level to the national and international level. So I think it's strengthening that local response, making sure that the public health workforce is connected to a strong public health infrastructure. I think about the work that we're doing here at TEFINET, where we're building the public health workforce and training frontline epidemiologists to strengthen surveillance systems around the world. What we want to do in the future is make sure that there is that connection to national systems and better communication with international systems. If we have that, it would shorten the time of disease. It would make us more proactive rather than reactive to responses, and allow us to get into address things sooner. I think right now Uganda is a very good example of what's going on, where they have a case of Ebola, and the international response is trying to do the traditional IMS, go in and just a whole international response, where Uganda has a very strong public health infrastructure and a strong FETP program and strong surveillance. But what they don't have is fuel in rural areas to make sure that information is passed, that you can go and do outbreak investigations. They're lacking internet sometimes to make sure that the surveillance reports get up to the national level. So in strengthening that type of support around the world, I think will help do that, and maybe shorten the response time, allow us to be proactive and prevent because of our globalized world, prevent disease from crossing borders as fast as they do. Also, I think just in the national response, and I would turn it over to Jill and Caitlin to know more, but in the United States, we were talking about it in the winter, and when we started to get the cases, they'd already been circulating in the US for several months. I guess, again, getting that local response in New York, what could we have done to detect that it was there in November when we saw what was happening in China? What was missed there? And I think there are a lot of solutions to be explored. I'm less strong on US, but I think lessons that we're applying in other countries could be applied here also.
That's a great point, Lisandro. And let me turn to you, Caitlin. On that particular point, on how the United States dealt with the surveillance. On the one hand, we have one of the most advanced healthcare systems in the world, and yet on the other hand, we do have a lot of kind of fragmentation in terms of how the cities and states and private hospitals all communicate. How do you see a more streamlined and integrated surveillance system working in the United States?
It's going to be really tough in the United States. Like you said, we have an incredibly fragmented, underfunded public health system. And so the way that data is driven is from the bottom up, from these local organizations to the up. And so what that means is we need to strengthen data infrastructure, everything that Jill and Lisandro said at the local level, and then somehow connect it all so we can get a national picture of what is going on. And that is a tall order. Because we don't have a national healthcare system like Israel or the UK have. It's not impossible. We need to do it, but it's going to take time. It's going to take investment, and it's going to take a ton of teamwork. So, I guess I'm optimistic, but it'll be interesting to see where that goes. I think the other thing that I've been really honed in about, and really is an umbrella for everything that's been talked about so far on this panel, is the need to strengthen our communication. We need first-class communication. We need to consider it. It cannot remain as the secondary focus in the United States. There have been other countries that have done amazing jobs in communication, like Vietnam, for example, or South Korea. And we really need to translate it into action for collective, a timely response to new threats or even ongoing threats. It's going to be impossible to gain trust with the public without it. And it really needs to be at the forefront of our preparedness. And so that's something that I think will be really important, again, across everything of surveillance, of data infrastructure, of gaining trust from the public, of everything. We really need to touch on that communication aspect as well.
Absolutely. I think one of the important learnings of this pandemic has been how vital it is to gain the public's trust to provide accurate information. We've seen so much disinformation, so much mythology around the pandemic that has really hampered the public response. You mentioned teamwork as well as we look to the future. And, Jill, I wanted to turn to you on that front because I know Genentech has really focused on the importance of novel partnerships in trying to address these kinds of crises. And here at the Chamber, we have been all in on looking at partnering differently as we stood up the Global Task Force for Pandemic Response and the Global COVID Corps as examples of public-private partnerships to address these challenges. But Jill, can you talk to us a little bit more about, the kind of partnerships that you're advocating for at Genentech?
Absolutely. And I think we are all on the same page that collaboration, communication are going to be key. One of the things that I found most encouraging during this crisis was everyone that we talked to, whether it was government, academia, others in industry, everyone said, what can we do to help? And that led to new partnerships that we've never explored before. For instance, our bread and butter is scientific research. We want to bring the next innovations quickly. So we partnered with others in industry to immediately set up combination studies of new therapies in order to get those tested and see if they were viable. Additionally, when it came time we did find as industry a potentially viable therapeutic, we had to say, well, how can we help you? We happen to have a manufacturing capacity. So we partnered with an industry peer to manufacture and distribute their therapeutic, both in the US and around the globe, because we could. It wasn't our medicine. It wasn't something we would normally partner with a potential competitor. But in these cases, we came together in order to make that happen. When it comes to these type of novel partnerships, I think we have a lot of different opportunities, partnering with tech companies in order to enhance this surveillance. We can't look in our sort of myopic industry anymore either. We need to think about communications. How do we combat misinformation in the healthcare space by leveraging the knowledge of advertising and communications firms that we haven't worked with before? And this is an area where I am super encouraged about the future, actually. As a result of this effort, we've actually just initiated a new coalition that combines academia, industry, and others called the Medical Countermeasures Coalition, which is designed to advance public policy and coordination for innovative medical countermeasures. So we are starting to stand up structures that previously didn't exist in order to be prepared for the future. And we're looking for new ways to incorporate our non-traditional partners. And so I think that is an extreme positive and something we're very excited about as we plan for the future.
So in addition to having new partnerships, new coalitions, as you referenced, it's also obviously going to require, new groundbreaking technologies that will help us get ahead of the next pandemic before it happens or the next health crisis. Lysandra, why don't I start with you? What are some things on the horizon that you're tracking that give you hope for how we address future crises?
Well, I think we're talking more. I think that that's an important thing. And like, again, these private and public partnerships are good. And I mean, I just think of the work that Caitlin's doing. Is the communication part is really important, and we're talking about lessons learned, and it's applying it into the next, or hopefully, or the next pandemic or next emergency that's going to come. I mean, that's what gives me hope. Is I do just see us talking more, and I see us questioning, at least at the international level, we're questioning how to respond and how to support countries. Again, trying to support at that local level, how to strengthen institutions, not just workforce, how to connect better from the local level to the international. I mean, there's still a lot of work to be done. There's a lot of discouraging things that came from it too, of course. But I think that stepping back and just saying, wow, a lot went wrong, and not having that hubris that we've done everything well. I think that is the first step to really changing how we can do things in the future. Though, I mean, we could say these are lessons that we have to learn over and over. It's not the first time that we've been combated with a huge public health threat, and we said we'd learn, and then we forget later. But yeah, no, I think that's good. It's just like that taking a step now. I agree with Caitlin. We're in a weird time, but it is a time where I think we're looking forward and planning what's next and how to take a breath to see how to improve institutions both nationally and globally.
Caitlin, building on what Lissandra was saying, do you feel like epidemiologists have kind of reinvented or rethought their approach to disease response as a result of some of these lessons that we've learned from the current pandemic? What do you think will change as we move forward?
You know, I don't think epidemiologists have had time to even breathe. We have been overwhelmed, honestly, in the past 30 months, and continue to be with monkeypox and polio and Ebola. I mean, they just keep coming, and this is going to be our new reality, I think. And so I hope that we as epidemiologists are given the grace to have some self-reflection and to really think through this. But I will say I have never been more proud to be in the field that I am in. And we did a lot, and we continue to do a lot of innovative things in the moment. For example, leveraging Google phones to see where people were staying at home or not staying at home, and how much community movement there was, and is that driving transmission, I thought was super innovative and in the moment. And another public-private partnership. The other really cool thing that we've seen come to fruition is wastewater. This wasn't new before the pandemic, but is this tool, this passive tool that's incredibly powerful, that we can use with polio, that we can use with other viruses that don't determine testing behaviors, for example. And so I, as an epidemiologist, I have a lot of faith in our field. I'm very proud and excited to be a part of them. We just need a lot of help too. And so I also empathize with all of our public health workers right now.
Absolutely.
Yeah, I mean,
sorry, go ahead, Lissandra.
Sorry, I just agree very much with what you're saying. And I mean, the first thought that I had also, just like lessons learned for epidemiology. I mean, I just remember when I was working and getting into public health and my first career as an epidemiologist, we go in wanting to do science. And I think that this has taught us that our role, at least in responses like this, is beyond the science, and that it will be influenced by politics, and it will be influenced by society, especially when big things like COVID and polio and monkeypox. And I mean, I think it surprised a lot of epidemiologists that I just want to sit here with my data set and analyze it and put out my reports and maybe publish here and there. But this overwhelming response and large microscope. So in the future, I mean, again, I love that you said, please give us some grace and give us the time to figure out what was next. But it was eye-opening to see that. It's just your comment reminded me of that.
Well, recently I was going to GW Hospital, and I saw this big, massive sign on the outside of the hospital that says "Heroes Work Here." And as I think about the role that our scientific and medical community played in the last 3 years in really navigating this unprecedented time, it really does reflect kind of that sentiment of the heroic effort that came. But as we think about the future and we think about how depleted so much of this community must be feeling by the stresses that they have experienced, how are we in basically replenishing those front lines? How can we think about um, strengthening the scientific and medical and health community to prepare for the next series of crises, which Caitlin rightly noted are just a stream, a wave after wave of different things that we can see on the horizon? I'd love to hear from each of you on that, but maybe Jill, let me start with you since you talked about partnerships. What can we think about partnerships to strengthen our medical and scientific community?
Yeah, I think, well, one of the things that I find really exciting is sitting here with epidemiologists. I'm not an epidemiologist, but I do work in policy and in Washington. And so we are essential partners to work together so that I can give voice to the important work that they're doing. I want to take those reports to the people who make decisions. I want them to make quick decisions and take action so that we can actually translate this into reality. And so if you were to say, what do I want to prioritize? I think one of those things is actually enacting policy that enables our structures to listen to the epidemiologists, replenish the workforce, make the necessary investments. And we've seen legislation proposed in Congress related to this, prevents, for instance, in the Senate. And we know that the PAPA is up for reauthorization next year. Congress is taking notice and they have an opportunity to act. So how do we not only, and not that you guys aren't busy enough, we need to work on combating an existing pandemic, planning for future pandemics, and then the thing that we want to take off people's plate is the structure. We want to be able to have policies, agencies, and coalitions that can actually act on this readily without the stress of having to build the plane while we're flying it. So I think that's some of the things that we're really thinking about for the future.
Caitlin, why don't I turn to you next? How do we build up the reserves to face the next crisis?
That's a good question. I think that low-hanging fruit is empowerment of public health departments, of public health workers. There was a lot of us being the bad guy kind of stuff, us not working with communities, losing trust. There was a lot of politics in public health, at least in the United States, and it was very exhausting. And so I think we just need to get back to public health 101, at least for us public health workers. And again, it goes back to also what Jill just said, is investment. We cannot get out of this cycle of neglect and panic without investment into our public health system. It's just going to be like what we saw with COVID-19 or H1N1 or SARS. It's going to be this continued cycle unless we can get out of it. And so that investment is needed for that frontline force.
Let me turn next to you, Lissandro. Training the frontline responders is something that you're very familiar with. Can you maybe talk to us about a little bit about how we build that surge capacity in?
Yeah, absolutely. I think it goes back to what we were talking about earlier. Is globally, I think the idea of strength investing in that the public health workforce. So, I mean, obviously, I'm a big supporter of the field epidemiology training programs, but that is building that institutional capacity. It's the workforce capacity, but also strengthening institutions, the National Public Health Institutes, in these countries, connecting the national public health institutes to international systems and programs. Again, supporting that field level work so we can, if we have a strong local response, it's done within the context of that locality, so you can be sensitive to cultural differences, right? So strengthening local response allows for a more human response, a more contextual response. And I mean, I know that it's CDC and TEFINET's goal to have a frontline program, which is that basic surveillance program in every country in the world, but also the stronger programs, and then the equitable access to those international opportunities so you can bring knowledge back to your country and strengthen your workforce. In the United States, I agree fully, investment, investment, investment. I mean, public health is now no longer a graduate degree. You see it in undergrad now. We have a lot of people who are interested in public health because of HIV and Ebola, and now because of the ways it affected their lives in coronavirus. It's one of the fastest growing master's degree programs in the country. So we have people that are interested. I mean, something I see, I know CDC has the Public Health Associate Program, which is connecting NPH grads and bachelor's people to local health departments. I would love to see just a massive investment in that so we can send graduates to the field to get that local context, to collect data so we can have better data collection. In my mind, I think of an AmeriCorps type thing for public health, where you can get people into communities doing public health work, and then they would support the state and then federal responses. So I think that there's a lot of opportunity, but Caitlin and Jill got it right, where it starts with a recognition of the needs, both in the United States and globally, and then the money behind it and the investment behind it.
Well, one additional point that maybe I wanted to throw into the mix as well is we saw in the COVID pandemic that businesses actually really leaned into the public health needs of the moment. We saw when the deadly Delta surge rampaged through India, that the human resources leaders across corporate America, with who had operations in India, or Indian companies, all became, in a sense, seized with the health emergency. Distributing home health kits, setting up vaccination sites, setting up clinics, etc., to essentially help augment the capacity of an already overstressed healthcare system. And I think that that's what gives me tremendous pride and also hope, that in times of crisis, we find that capacity comes from all different directions to try to meet the need of the hour. And I know at the Chamber, we were very, very proud to be able to bring that capacity forward from the private sector to support the needs both here in the United States and around the world. I want to thank all of you for joining us today. Certainly, we are continuing to learn the lessons of the pandemic. The three of you, amongst countless others, have been there as leaders in helping us understand and navigate the current situation, but also as we prepare for the future, how we can be better prepared. So thank you very much for joining us this afternoon.
Thank you so
Thanks
much.
for having me.
Mm-hmm.
Thank you.
Tamin'ny voalohany nanaovana fampianarana anazy zany a, da nosarosarotra avao. Kanefa niezaka zareo na mpianatry da ohatrany nalalaka be amizay, mora be amizay zany fampiasana anazy. Ka hatramizao zany komikera dia efa hainay ampiasaina tsara.
Speaking on behalf of Damagi, our company is committed to improving the lives of millions and billions of people all across the world through frontline worker programs. We are most well known for our platform ComCare, which is one of the biggest and most widely used platforms for supporting frontline workers all across the world. ComCare has enabled workers like the one you just saw in Madagascar to support her community, deliver life-saving essential services, register pregnant women, and refer those women to clinics as needed. We're extremely excited by the work that we've done to date, supporting hundreds of thousands of frontline workers all across the world. But the work that we've done at Demagi and the work that our industry has done is simply not enough. These jobs are getting more difficult. COVID-19 has decimated our public health workforce, made these jobs harder, more time, more investment, with little to no pay improvement across the industry. What we want to do over the next 5 years is make sure we make a transformational commitment to support these frontline workers so that they can deliver better outcomes for their communities. And we think that primarily starts with better jobs. These frontline workers are doing critical, essential services in hard-to-reach areas. They're often the only point of contact communities, families, or providers may have to the healthcare system. Hospital may be 100 miles away for some of these communities. These frontline workers need amazing, empowering tools because they're doing a job that is extremely difficult and very critical for their communities. And as we saw through COVID, if we're not safe everywhere, we're not safe anywhere. These frontline workers also act as frontline responders for pandemics, whether those are localized pandemics or global pandemics like we just had with COVID-19. And these pandemics are popping up again and are going to continue to pop up, as we saw or are seeing with Uganda and the latest Ebola outbreak. Frontline workers like this can be responding quickly and adaptively, but they need strong support from the healthcare system in order to do so. We are just starting our journey on improving ComCare to add 4 key capabilities that are going to support these frontline workforces. We call these learn, deliver, verify, and pay. We think by improving these capabilities, frontline workers all across the world will be able to do additional work for additional pay, improving their jobs to improve outcomes. Our canonical example is early childhood development. This is a service every new parent needs to learn how to better take care of their children, to support growth, nutrition, and education. And learning these skills, whether you're in a high-income or low-income setting, is critical and difficult. Becoming a new parent is stressful. Having support from your community is critical. As we say, it takes a community to raise a child. And with additional skills, learning how to do early childhood development can be done by non-specialized providers who support communities and households, delivering these essential skills. They deliver these skills after learning and getting certified, and we can verify that these skills were delivered through GPS real-time data collection that governments, partners, and nonprofits alike can support with these communities. And finally, they can be paid in real time for these additional services that they're providing. If we can bring together learn, deliver, verify, and pay for things like early childhood development, vitamin A distribution, mental health, and other areas, we can further build on the critical infrastructure that community healthcare workers and frontline providers have already created. The investment in this workforce is already in excess of $1 billion a year. It's estimated that there's a 10-to-1 ROI on the money spent in these frontline programs, and yet 86% of this workforce is not full-time employed. Many are volunteer and not paid at all, or many are poorly paid. And there's somewhere between 7 and 15 million frontline workers in Africa and Asia alone. This workforce is one of the best healthcare investments we can make. And we are really excited to bring technology to empower this workforce, not just for what they're doing today, but for what they need to be doing tomorrow to be a responsive and resilient healthcare system to support their individuals, families, and communities. I'm really excited to hand it over to Dr. Tanya Elliott, who will speak additionally about her work in virtual care.
Thanks so much, and what important work you all are doing. So I'm Dr. Tanya Elliott. I'm an internal medicine physician and an allergist by training, and I've been in the telehealth space for the last 10 or so years, had multiple experiences across startup, payer, and most recently provider. And one of the things I'm most passionate about is assuring that clinicians and care teams have access to technology to enable and improve care for their patients, but not just that, but they understand how to interact with and how to use the technology. So that's everything from embedding telehealth training and education into medical school curricula and residency curriculum, as well as training around asynchronous or near real-time data collection through things like remote physiologic monitoring. And today, as it stands, there really is very little education or training for providers that exists or is embedded within med school curriculum or residency training curriculum, let alone for our physicians that are currently practicing today. And we're only going to see an increase and an uptick in that technology and those capabilities. So it's going to be really important for us to engage our healthcare workforce and get them much more comfortable with the use of technology and what that means and how that changes their workflows, their reimbursement, their need to physically be in an office, the level of interaction that they have with their patients, and shifting the paradigm from meeting with the patient maybe once a year or 2 or 3 times a year for a snapshot in time into the ability to have continuous trends of data, not all at once, but at least aggregated for them to better understand what's happening in what we call the white space, but the time in between visits, which is when the real care really should be taking place. So what does that look like for a doctor who's very much used to seeing their patient just physically in the office with blood work that was from a week ago and a physical examination, which is from that day, and whatever the patient remembers from that given day? How do we transform that into longitudinal care delivery that's facilitated through technologies?
Thank you very much. Thank you very much, Jonathan and Dr. Tanya Elliott. It was quite interesting. My name is Norton Hurtado. I work with Doctors Without Borders Sans Frontières. And while waiting for the answers from the people online, we saw the change on technology, Jonathan. We introduced telemedicine and Dr. Elliott for sure, but we implemented technology from telemedicine 10 years ago when we started to see only a dozen of cases. And the last year we saw more than 3,500 cases. And 400 cases of that was real-time telemedicine. So, Jonathan, what would you say to people who try to implement change and innovation with technology alone?
I think that one of the huge things we've seen with COVID is this explosion in the rate of change of technology. But as Dr. Elliott stated, there's a huge transformation that goes along with that in terms of the patient and the provider experience, how accepting people are of this technology, and how to make sure it also doesn't get in the way of the human connections. One of the things that we're very proud of, and the reason that we chose to focus so much on community healthcare workers, is not just the health care that they provide, but the health promotion and that community connection they provide. And I think there's lots of great lessons on how technology can be introduced to be non-disruptive. But on the flip side, I think we also need to not be scared to be disruptive within the healthcare settings, because a lot of things are poorly designed currently, and making broken systems slightly more efficient is not exactly a worthwhile goal. Some of the huge opportunities with virtual care, with telemedicine, with digital transformation for these workforces is to redo the system design in such a way that takes advantage of a patient-centered approach and the latest in technology. So we think there's a lot of lessons learned from different examples of direct-to-consumer that's exploded within mental health care, with direct-to-provider learning and training, and with technologies in between. But for a lot of these, it's important to double down and reinforce what's working. And a lot of that has to do with the provider and the patient relationship and interaction, and then redo what's not working, inefficiencies in the system and other components.
Thank you very much. And just following on that answer as well, John, which countries and communities does Dimaji work in, and where do you support healthcare workers?
We work in over 50 countries in Africa and Asia, and we've worked in a total of over 80 countries in our history. We're very proud of the diversity of countries that we support, and we've seen all different economic segments within those countries and across countries. And the one commonality that we keep seeing over and over again is how dependent we are on the pro-social behavior of these frontline workers. They do so much for these healthcare systems. So do nurses, so do doctors, and so do many other actors in the system. But these community-based frontline workers provide an exceptional amount of support, particularly for underserved populations. And so that has been common across all 80 plus countries we work in.
Thank you very much. Dr. Elliott, now when then sometimes people get what we call health-associated infections while they're receiving healthcare for another condition, what examples have you seen of post-operative care happening virtually rather than risking infection by going back into the practices?
Right. So anybody that's immune compromised, anybody that's post-surgical, and then especially somebody who has an immune condition. So let's say they're received an organ transplant, for example. And I think Boston Children's Hospital does a great job of this, where all of their post-operative care for children that undergo transplants, organ transplants, the care is virtual, which makes complete sense. Asking a patient who has zero immune system to now physically go into a healthcare setting where we know there's a higher risk of infection simply just shouldn't happen now that we have the technology and the care that we can bring to the patients. Layering in, additionally, not just relying on maybe somebody's home thermometer, but home physiologic monitoring with things like biosensors, where you can actually baseline the patient prior to their surgery and then see how they're doing post-operatively. You can evaluate their skin temperature, whether or not they're ambulating, what their heart rate is, what their respiratory rate is. And we'll see more and more of these devices coming on where we'll be able to, just with a single patch, be able to check blood pressure, be able to evaluate pulse oximetry. So you'll have all of the objective data points and information you would need. And to some extent, as I was saying before, even better than an office setting, because in an office setting, I'm checking your blood pressure and your temperature at 9 a.m. But I have no idea what it was at 8:55 or 8:50 or 8 a.m. or 7 or 6 or what it was in the middle of the night. And with remote patient monitoring and allowing for that continuous data stream, I can now see what your average temperature was over the last hour, as opposed to the snapshot and time temperature. So we will see it becoming more and more quickly standard of care. One just thing to, talk, jump on what Jonathan had said is, what's really interesting about your work, Jonathan, is you are taking a frontline worker who previously didn't even have a voice and empowering them through technology and saying, hey, they're doing all of this work and we're not able to even track or account for it. And it's so important. And they're doing this education and we can't even do anything to quantify that. And so you're leveraging technology and embedding technology so that you can do that, so we can get credit for that care and empower that workforce. And that's really important. And I also think it's a really good place to start in technology, because they didn't have technology before. So you are solving a problem where previously these people went unheard and their care went unrecognized that they were providing to communities. One of the challenges with traditional healthcare is are we going to rip and replace the existing technology? And not only that, the existing technology that we have, the electronic health record, in-basket messages for providers, it is the bane of their existence. You see more and more that it is correlated with physician dissatisfaction. So I challenge the people that are listening here today. So let's think through solutions. I love thinking about net new solutioning, where maybe the answer is just a frontline caregiver that doesn't necessarily have a background in healthcare, and then they are supported and they can escalate to a provider, but that provider is not chained or tied to an existing infrastructure and an existing technology, existing real estate and existing EHR. So maybe we should think about new care delivery models. And I love maybe starting with the people that are already in communities. And we know that already works. We've seen the peer-to-peer work for blood pressure reduction. So not just for monitoring or surveilling patients, but also managing chronic conditions. So I really like this model, and again, challenge everybody listening to let's think about innovative care delivery models and recognize the challenge of a rip and replace model.
Thank you very much, Dr. Elliott. Quite interesting. And it's a good segue for the next question that we have. It's for John. Could ComCare ever be used as a telehealth platform to connect patients to providers in this innovative way?
Yeah, it's a great question. And to build on what Tanya had just spoken to as well, we acquired a company earlier this year that was focused on patient adherence for tuberculosis. So in the United States and many other jurisdictions, if you are diagnosed with TB, you are legally required to take your medications, or you can be quarantined. And observing that taking of the medication requires the patient traveling to a clinic and having a nurse or other healthcare professional observe them taking the therapy. The company we acquired, Shirt here, built a digital component where you can asynchronously record yourself doing this, submit it to the nurse, and she can watch it at the end of the day in bulk. So it's a better patient experience, it's a better nurse experience, and it's more efficient for everyone. And so a lot of the benefit of these wearables and new technologies, it's a 2-for-1. It's better healthcare, and it's also a better patient experience. And there's a lot of win-wins here that are going to lower cost, improve the patient experience, and that end up with better healthcare. So we're taking that Shared Here platform and entering the clinical trial space and supporting international growth of observed therapy for not just tuberculosis, but also opioid treatment for medication-assisted therapy that also creates a better experience for the patient, for the provider, and lowers cost overall. So absolutely, virtual care in these areas is a big area for expansion for Demagi.
Thank you very much. And it's been quite interesting. And after all we have discussed today, what ultimately makes you the most excited about the future of telemedicine and the improvement of our healthcare processes? A question for both of you. I will start with Dr. Elliott, please.
There's so many things that get me excited about this space. I think probably remote physiologic monitoring and asynchronous care delivery. So, we got really good at the telemedicine 1.0 during COVID, which is sort of what we're doing right now, which is a real-time audiovisual interaction. But I really like, and so it's almost to some extent replacing a brick and mortar. The difference is now we're not physically in the same location, but we're speaking synchronously. What excites me the most, though, is the asynchronous interaction. What you just described, Jonathan, around batching medication, video-assisted, medication adherence. Doesn't that make complete sense? Just record yourself on your phone taking your medication, and then a nurse doesn't physically have to trek all the way to a physical location, or the patient doesn't have to physically trek somewhere. But you also don't have to coordinate all at the same time, someone standing there staring at you, watching you take your medicine. It can be done asynchronously. So think about what that can do for the current shortages that we're having with our workforce around physicians and particularly our nursing shortages. And then also the impact that it can have on communities that don't have access to care. So again, the asynchronous interactions that are not in real time, as well as the ability to now physiologically monitor patients and gather this data in aggregate, and then track and trend it over time, and then see what correlates with disease risk and disease progression. That is absolutely the future of medicine. It's not just the future of virtual care or telehealth. It is the future of medicine and healthcare delivery. And the last thing I'll say is just that we need to get with the times and make sure that we're actually training our clinicians and care teams so that they're able to provide this care. Because guess what? The technology is already there.
Thank you. Jonathan?
Yeah, just to add, I think that was a great summary from Dr. Elliott. And our only piece is focusing on that provider and making sure she or he has a better job. At the end of the day, this work is challenging. It requires a ton of innovation going forward. It's going to get more expensive. We need more funding going into low resource settings. And it's all got to anchor around the people providing this care and how do we make their jobs great so that they can create amazing outcomes for their communities.
Thank you very much. Amazing discussion. I'm really excited to see the future of telemedicine in health. Thank you.
Describe Saving Our Daughters is, to the name, it's just about encouraging young girls, many different girls from everywhere. And the organization is just a place where different people in different fields can come and spend time and inspire the girls to live out their dreams and to let them know that it's possible. Like, that's what it's about in life. It's about giving what you've been given, spreading the love.
Your voice is amazing.
Writing is really big for me. So writing songs, although that is a part of my career, it's how I get my emotions out.
I do a lot of yoga. I do therapy once a week, and I see a dietitian once a week also. Very, very important to have a good sense of and relationship with food, because if you don't have the proper nutrients, your body and your mind can't take in the nutrients that it needs.
One of the things that I really love to do, that I do every single day, is journaling, as well as meditation. It allows me to be, really centered, really quiet, and it allows me to tap in to whatever I'm feeling in that moment.
I didn't realize if I did not take care of myself first, I couldn't take care of other people. And so recently I have learned, in terms of looking into my likes, is listening to music. I also love working out. I'll do that maybe 20-30 minutes a day.
I've struggled with depression and anxiety for basically my entire life, and I've been in and out of treatment for the past year. So it's a very, very heartfelt topic for me, and very personal.
The more you educate people on different types of mental illnesses or mental health issues, the more people feel comfortable in whatever they may have. Because if you know you're not alone, okay, I'm not crazy for feeling the way that I feel. There's help out there. There are people who get it, and there's a way to overcome it.
When something happens to you on the outside, if you get injured on the outside, you can see the bruise, you can see, maybe the blood, you can see the effects, the scars on the outside. But when we're talking about mental health, a lot of times people are going through a lot of different things, but you just might not see it.
Mental health awareness is important to me because it's one of the biggest problems people struggle with without even realizing it. I mean, tons of people have undiagnosed mental illness because of their unawareness of the symptoms and causes. That's why I also think it's important to educate people on these symptoms and causes to spread awareness.
Our bodies are our own. Our minds are our own. And so to be able to make sure you take the time and have the awareness to check in with yourself on how you're feeling, what your needs are, and knowing that I am important too and I am enough.
So the last thing I want is for someone to suffer in silence.
Don't be afraid to take time for yourself. That's like a really big thing, especially in the age of social media and like being online.
I'd say find help as soon as possible if you feel like you do need help. There's no shame in asking for help or needing more help. It's just a part of life, and a lot of people are suffering from anxiety, depression, mental illness, and it's just so important to take care of your body and your mind.
Your feelings and your thoughts are valid, and sometimes it just takes talking to just one person to change everything.
If I were to meet anyone struggling with mental wellness, the first thing I would do is reassure them that it isn't anything to be ashamed of. Because after taking that first big step of first acknowledging the problem, then they can work to better themselves. And also remember, please don't be afraid to ask for help.
Yeah, it's been basically a dream of mine for my entire life to inspire people and help people be the best version of themselves. So seeing these little girls be inspired by me just really lights my day.
I really like the feeling that I can be an inspiration to somebody, or that maybe something I've said or something I've done has supported someone in some way.
The things that I have learned, I can take and share with other people because it's been meaningful to me. So hopefully it can be meaningful to other people too. That mostly at the end of the day, you are enough.
That was truly inspiring. Thanks to all the celebrity mentors who shared their advice. I'm Selena Smith, and you may have recently seen me on Annie Lyle on NBC or Tyler Perry's Young Dylan. I'm also part of the Saving Our Daughters mentorship program. This program focuses on promoting a positive mental environment for young girls. And today I'm joined with one of our star mentors and my friend, Elena Onale. Elena, it's so good to see you. How are you?
Hey, Selena, it's so good to see you too.
Yeah, I'm so excited to have you. Well, you are already an inspiration and a role model. I mean, you're a pre-med student at age 13. I mean, come on, girl, you are killing the pre-med game. And you are also one of the founders of the Brown STEM Girl Foundation, and you recently became a mental ambassador for Saving Our Daughters. So, to begin, tell us, what are your personal values and how do you stay focused on your goals with STEM and medicine?
My personal values are to, one, just stay true to myself, keep integrity, and how I focus on what I'm doing with med school and school is keeping a good schedule and living literally by my calendar.
That's amazing. Well, I know that you are, you are a pre-med student and you've got a lot of stuff going on in your schedule. And I know sometimes that can become, stressful. So how do you, when you're down about things, how do you get back on track? And like when you're down, like how do you get back to that, mental state, of happiness and stuff?
Well, I love to do many different things when I feel stressed just to pick me back up from, I don't know, hanging out with friends to baking and sometimes running in the morning, just to help me get back up.
Amazing. I know when I'm stressed, I like to work out and I like to exercise. So, do you prioritize good nutrition and exercise, and how does that impact your wellness and your health?
I do prioritize exercising because that's what gets me up in the morning. I love to go running. I love to exercise when I have some time. And I do love to eat healthy. I know sometimes that might not always be something I can do because I'm in college and sometimes I just feel like snacking, but for the most part, I do love I do love to eat healthy.
That's amazing. Well, okay, now we have a few questions from our Cinderellas coming in, starting with Brooke.
Hi, my name is Brooke Monet, Westbrook. I'm a senior in high school, and I am the TikTok director for Saving Our Daughters. And I believe that this question would help me and my peers out with a lot of self-esteem issues. So I was just wondering, what advice would you give girls who struggle with positive self-esteem that is affecting their studies and peer relationships in school?
The advice I would give to girls who are struggling with self-esteem, positive self-esteem, is to never give up on yourself, to follow your dreams and know that you're beautiful in everything that you do and no one can tell you anything else.
Hi, I'm Gisela, but you can call me GC. And my question for you is, what does a great friend look like to you, and how did you know when you found a great friend?
Well, a great friend to me is someone who is supportive of you in whatever you're doing. They're always there, no matter what you're doing or who you are, and they know that sometimes you may feel down, and they're there to pick you up. So yeah, that's what a great friend is to me.
Hi, I'm Gabriella, but you could call me Gabby, and I'm 11 years old, and I'm in the 6th grade. And I have a question. The pandemic had forced us to adjust in major ways that have been particularly challenging to the youth. How did you deal with the stress?
Well, as somebody going through the pandemic, I made the most of it, making sure I kept up with my mental health. And I think that was important because us as, youth, we need to make sure that we're taking care of our mental health and that we're doing okay, whether it's reaching out to friends and family or creating groups just to sit down and talk. So that's a little bit of what I was doing.
Hello, my name is Abigail, but you can call me Abby. My question for you is, what is your favorite creation you have made with Legos?
My favorite creation that I've made with Legos has to be the Millennium Falcon. It was the biggest Lego I have ever done. It took me around 14 hours, but it was fun.
14 hours. Oh my gosh. How do you do that? I have never heard. I have a bunch of friends who, like play with Legos and stuff, but I have never heard 14 hours. That's crazy. As a mental health ambassador, what makes you feel optimistic for the future of mental health?
As a mental health ambassador, what makes me feel optimistic is to know that there are others out there who want to prioritize mental health, that we are spreading mental health everywhere, because that's what's needed for youth. We need mental health.
Thank you so much, Elena. It's been so wonderful talking to you. I cannot wait to see all that you accomplish. Thank you so much.
Thank you. It's good talking to you.
Wow, what a sweet way to end the program. As you might know, this week is Mental Illness Awareness Week in the US. And I know I'm certainly more hopeful about the future of mental health after listening to those inspiring young girls that represent the next generation of leaders. I'm Hillary Crow, Vice President of Programs here at the U.S. Chamber Foundation, and I want to thank all of today's speakers. We really appreciate you making the time to participate and share your expertise with us. We covered a lot today. To the audience, thank you for tuning in. We hope you learned something new and are feeling inspired and hopeful about the future of health. And thank you again to Genentech and Walgreens Boots Alliance for your support. Our next installment of the Fast Forward series will take place on December 8th with Talent Forward, focused on the workforce revolution we need for the future. We know our economic recovery, opportunity, and competitiveness depend on the strength of our workforce, and we look forward to highlighting employer-led solutions that will drive us forward, as well as critical ways that business, government, philanthropy, and education will need to work together to create impactful change. You can register for Talent Forward now on our website at uschamberfoundation.org. As a follow-up to today's program, please be on the lookout for a post-event survey coming to your inbox. We want to hear from you on what topics we should cover next year and how we can make these programs stronger. So please take care of yourself, and we look forward to seeing you again soon. Thank you.